Hello, my name is Dr. Chuck Marler. I'm a family doctor at Benefis. I have been here since 2013. I also do geriatrics, where I work as a medical director of the Grandview. In general, if, say, for example, you have been healthy as a teenager and gotten all your sports physicals, and next thing you know, you're 32 years old and you've never been to the doctor, my first question to you in the office is going to be, how often do you change the oil in your car? And usually what I get from a lot of my patients is they do it every 3,000 miles, because it's very important to make sure you maintain your vehicle. The next thing I ask is, what's more important, you or your vehicle? And usually they give me a quizzical look and then kind of get the idea that you should take care of your body much more than you should take care of your vehicle. So the answer is really, if you're thinking about going to the doctor, or you have concerns, or you have any questions, you should make an appointment with a primary care physician. I have a lot of couples that come to see me, and men and women. Men typically, like myself, say everything's okay, and their counterparts, sometimes their partner, usually will tell things differently. And so for my male audience, I would suggest to not believe what you're thinking. Because before, I used to be in a town where if you got really sick, you'd have to take a helicopter ride. And I had a lot of men in their 40s and 50s who came to see me one time, and that time they took a helicopter ride because they waited 20 years to get stuff done. And they ignored vague, weird symptoms. And so don't be a helicopter ride. My answer would be, go back to number one, which is worry about all of it. You know, a lot of times we think we're fine. We think there's absolutely nothing wrong. And yet we do a screening at work, or we get a blood pressure check at the gym, and we see the number and we kind of ignore it, or we don't think it's a big deal. And the problem is again, if you ignore the initial warning signs, you might have what I call your sentinel illness, or your first illness. So if you're having vague symptoms, even symptoms that you would per se ignore, there is a certain chance that you could have your first event. And an event is something that would change your life, like a heart attack, like a stroke. Put it this way, if you're driving down the road and a warning light comes on in your vehicle, or you hear a noise, and you're with your wife in the other seat, I guarantee you're probably going to do something about it. So if you have a warning light on your body, or if you have a warning light symptom, don't ignore it. And the answer is, what should I do at what age? Well, the answer is not to ignore it. And if you have a primary care provider, you can, either through the portal, or through phone call, or through actually visiting the doctor, ask those certain questions, especially at your annual exam. Your annual exam is like your oil change, but once a year. Should everybody have an annual exam once a year? There's no way for me to answer that. It depends on your family history, your medical history, and the decision that you make in your one-on-one visit with your primary care provider.
Hi, I'm Katrina Paulson. I work at Benefis Internal Medicine as a physician assistant. I have been a physician assistant for over 20 years. 11 of those have been here at Benefis. So that's a great question. A lot of women have to make appointments for their husbands. I myself have to make them for my husband. Yes, you can make appointments for any of your family members. If your spouse wants you to come with them, you can also come with them to the appointment. As far as cancer screening goes, most cancers in internal medicine, we start screening in your 40s. So for colon cancer, they now recommend that we start doing colonoscopies at age 45 for just the standard population. The screening interval for colon cancer varies based on whether there's a family history if you had a polyp on your colonoscopy. An average screening interval for a person with no problems would be 10 years. If there's a family history, it's every 5 years. For prostate cancer, they've changed screening guidelines over the past few years. Average person with no risk factors, we recommend starting at age 55. If you have risk factors such as family member with prostate cancer, if you're of African American race, you're at higher chance of having aggressive prostate cancer. In those cases, screening intervals start down to age 40. The follow-ups and frequency thereafter depend upon your results. For skin cancers, usually we recommend you get that checked at your annual physical, or you can go to a dermatologist and have them do a once a year head-to-toe skin cancer screening. As far as blood work goes, we usually recommend annual labs. The frequency, usually we'll get annual labs the first time you come in, and then thereafter depending upon your results. Lung cancer screening for smokers only is recommended to start at age 50, and you continue once a year until you're age 77, or if you quit smoking for 15 years, then we quit doing lung cancer screenings.
Hello, my name is Dr. Michele Marler. I am a family physician, practicing medicine since 1996 and in the Great Falls area since 2013. And I am in the Benefis system in family medicine. So the United States Preventive Services Task Force website is a great place to look. And it will tell you at what age what screening is recommended. For men's health, I would like to say that there are things you can do to stay healthy without prescription medication. So don't feel like that an appointment to the doctor means you're automatically going to be sent out with a prescription. We have lots of tools in our back pocket to share with you on how to stay healthy.